for time of your very busy schedule. I am Dr. Christine Hartford. I am a pediatrician with NYIT College of Osteopathic Medicine at Arkansas State University. And joining me tonight are Dr. Carl Abraham, who's an infectious disease specialist, and also Dr. Ronald Onley, who's a family medicine doctor with a specialization in addiction medicine. And what we're going to do tonight is I'm going to go through the slides, and you should see a chat box button at the bottom of your screen. So if you think of any questions as I go along, feel free to type them in the box or at the end, and then there will be some time, and Dr. Abraham and Dr. Onley and I will try to answer your questions the best we can. So there is so much that we could talk about tonight, but we're going to try to hit on some subjects that will be helpful to you simply as somebody trying to navigate this pandemic, but also touch on some subjects that we thought would be helpful and interesting to you as a parent, things that you might be worrying about and thinking about in terms of your children and your family. So we're going to give a brief introduction just about COVID in general, then talk about specifically what we do and don't know in terms of COVID and children, talk about all the protective measures that we should be adhering to in terms of how to protect ourselves and others, because that's just so very important right now. And then talk about how can we live in this time? How can we send our kids to school and have them play sports in a way that's safe? And how can we help them cope during this difficult time? So just a few definitions. Coronavirus is viruses. There are about 7 of them that are known to infect humans, and most of them, 4 of them in fact, cause very mild disease, just runny nose. Many of the common colds that we all get every year are due to coronavirus. There are 3 strains that can cause very severe disease, one of which is called SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. And this is the virus that's responsible for everything we're dealing with today. This is the virus that's causing this pandemic. The symptoms that this virus causes, the shortness of breath, the cough, the fever, the things that are making people end up in the hospital, those symptoms are referred to as COVID-19. COVID-2 is the virus that causes those symptoms. So how are we doing in the United States? Unfortunately, not very well. This is a graph of the cases starting back here in March when the pandemic began. We went up a little bit, did a little better, up again, and then here we are right now. And look at how steep this curve is going. We've hit over 11 million cases in the United States, and this was as of this morning. I updated this. Over 166,000 cases yesterday. And, you know, I remember a time not that long ago where we were sitting at around 60,000 cases, worrying about when we would get to 100,000, and we've been over 100,000 cases a day for several days in a row now. Looking at Arkansas, unfortunately, things are not looking good for us in our state either. Sort of similar shape of the graph. And you look here over the last just couple weeks, how steep that graph and how steep that curve is. And we have had over 1,000 cases in a row for several days, and we actually had one day where we had over 2,000 cases. So that's very concerning. This is just shows you the geographic distribution in the state. On the left is by school district, on the right is by county. So let's just look at this one. Here on this map of school districts, green is good, yellow and orange are getting a little bit higher, and then the red and the purple are towards the higher end of the spectrum. And so you can see up here in Northeast Arkansas, where NYIT is, unfortunately, we're towards the higher end of the spectrum. So what are the symptoms of COVID? I think many of us are familiar with these by now. This is right off the CDC website. You have your fever, chills, your respiratory symptoms like cough, sore throat, runny nose, congestion, then your generalized aches, headaches, even some GI symptoms like vomiting, diarrhea, and then also the loss of taste or smell, which tends to be, that's a little more unique for COVID. But other than that, these symptoms are very general, very what we say non-specific, meaning we see them with lots of different things. These symptoms, they cover a very wide spectrum. Some people have very mild symptoms, just a little bit of runny nose and cough, and some people have severe shortness of breath and, you know, have respiratory failure where they need to end up being intubated and mechanically ventilated. The other thing that can happen is you can have an asymptomatic infection, and that means you're infected with the virus, but you have absolutely no symptoms whatsoever. And the important thing to know about that is that even if you're asymptomatic with the infection, you can still infect other people. I think that's very important to know. It's why it's so important for all of us to be wearing our masks. And I think it's one of the reasons why it's been so difficult to get a handle on this pandemic. A little bit about symptoms and transmission. So symptoms can arise anywhere from 2 to 14 days after you've been infected with the virus. And that's a fairly wide window, especially compared to other viruses. And remember that 14, because that's where our quarantine comes from. And we'll talk about that a little bit later. Once you're infected, you can actually start spreading the virus and infecting other people even before your symptoms start. In fact, about 48 hours before your symptoms start. So again, we can be feeling great, walking around, but potentially infecting other people. And most people spread the virus for about 10 days after their symptoms starts, and that's where the duration of isolation comes from, which again, we'll talk about later. Oops, sorry. So what do we know about COVID and children? So here are the symptoms of children. Again, the variety of symptoms in children are very similar to what we saw in adults. This is from a study of 1,600 children that was published a couple of months ago. So that's where the percentages come from. I just want to point out a couple of things. Again, these symptoms are non-specific. If you look at this list, we've seen all of these symptoms in our kids lots of different times. So it's really difficult to simply go by symptoms to know whether or not it's COVID or not. I also want to point out the fever, because I think we focus on fever a lot as a sign of infection in kids. And while it can be a sign of infection, in this study, less than half the children had fever. So we can't fever alone. And then I also want to point out in this study, 16% of the children were asymptomatic. And actually other studies that have been published after this have shown much higher rates of asymptomatic infection in children, up to maybe even 40%. So it's really important to keep in mind. As far as the little ones, infants and neonates can also be infected with COVID, and their symptoms can be a little different. They can be a little more vague, maybe just some lethargy or poor feeding. I wanted to mention the MIS-C, the multi-system inflammatory syndrome in children, because you may have heard about that. This is something in adults, but definitely something we think of more in children. And this happens a little bit farther out. This happens like 2 to 4 weeks after the infection with the virus. This can present as fever, which tends to be prolonged, so several days of fever, some GI symptoms, and then a lot of involvement of skin and mucous membrane. So rashes, conjunctivitis, which is the redness of the eyes. This can affect really any organ system in the body. It tends to be really hard on the heart. So cardiac dysfunction, meaning our heart is not pumping as well, myocarditis or infection or inflammation of our heart, and even coronary artery aneurysms can be seen. As of the end of October, there were 1,163 cases of MIS-C reported in the United States, and 20 deaths in children attributed specifically to this. The average age of children in this series is 8, but it has been reported all the way from less than 1 year of age and all the way up through 21. And then, as I mentioned, now we're starting to see it rarely in adults. I wanted to mention a little bit about neonates and infants, because I know some of those of you who registered had some questions about that. Overall, the news is good. Most neonates and infants do just fine. There's a registry, a perinatal registry, where we're looking at mother and infant pairs, and there's about 3,000 pairs in that registry so far. And of those, 2% of the neonates who were born to a mother who was positive for COVID tested positive in the first few days of life. And we're still learning a lot about this, but what we think is that the risk of in utero transmission is very, very low. And most of these cases in neonates are thought to be due to close contact of an infected person after birth. But what we've seen is that it really doesn't make much difference whether the baby is separated right away from birth or not. And that was something that was being done right at the beginning of the pandemic when we were still learning a lot. But what we've learned is if mom wears a mask, has good hand hygiene, that the baby can stay with her, which is good, because that separation can have really detrimental effects. Most of the infants, even though the ones that did test positive did very well, the complications that were seen were respiratory distress and low birth weight. As far as breastfeeding, that also is safe. There have been no live virus found in breast milk. So moms can continue to breastfeed. They do have to be very careful with wearing a mask and good hand hygiene, and some moms will elect to pump and then have another caregiver feed the infant. So what about numbers of COVID in kids in our country? So as of November 20th, which is the American Academy of Pediatrics puts out summary data every couple of weeks. So this is the most recent report. There were over 1 million cases of COVID in children, which represents 11.5% of all cases in the United States. We know that thankfully the course of the infection overall is much milder in children compared to adults. When we look at hospitalizations, over 6,000 children have been hospitalized in our country because of COVID. And so if you look at all COVID-related hospitalizations, 1.7% of those are in children. And if you look at all children who are infected with COVID, 1.6% of them need to be hospitalized. So overall, children are doing well. There have been, however, 130 deaths in children in our country from COVID. So this represents 0.06% of all COVID deaths. And then of all children who are infected, 0.01% of them have died. So overall, thankfully, children are handling the infection physically quite well, but this certainly doesn't tell the whole story if you think of all the other ways that our children are being affected by this pandemic in terms of their education, their socialization, and their emotional health, which we'll touch on later. Looking specifically at Arkansas, there have been over 16,000 cases reported in children, which represents 13% of all cases and 0 deaths. So who is at increased risk? We know in general the elderly and those with underlying medical conditions are more at risk of having severe infection. Looking specifically among children, at those children who did end up needing to be hospitalized or who died, it was again more common in children with underlying medical conditions. So in one study looked at deaths, 75% of children had an underlying medical condition. The more common ones were chronic lung disease, obesity, neurologic conditions, and cardiovascular conditions. Death was also more common in the older children. So 70% of the deaths occurred in the age group of 10 to 20. And even among that, it was more towards the older spectrum. And deaths were more common in children who were Hispanic or Black. As far as hospitalizations, those are also more common in the older kids and then also the younger. So being under the age of 2 has an increased rate of hospitalization associated with it. And in one study, 18% of those who were hospitalized were actually under the age of 2 months. I wanted to mention a little bit about susceptibility and transmission because we're hearing a lot about that. And I think the bottom line is that children are susceptible to this infection and children can infect others. We are still learning a lot about this. Some data suggests that the younger children under the age of 10 in particular may be less susceptible to infection, and that the very young children may be less likely to infect others compared to adults, but I still think we're learning a lot about this. I've certainly read reports of an 8-month-old infant infecting her parents, and there's a household transmission. So if someone in your home is infected, how likely are they to infect somebody else in the home? And in that study, the infection rate, what's called the secondary infection rate for children under the age of 12 is actually over 50%. So children infecting over 50% of their household members. And so I think for any one family, it's just important to understand that your children can be infected and your children can infect other people. So I couldn't meet with a group of parents tonight and not mention something about influenza. The flu season is coming soon. It's right around the corner. I'm sure we're going to start seeing cases here fairly soon. And if you think back to those symptoms of COVID, they were very similar to the flu. A lot of those symptoms overlap. So it's going to be really impossible to tell when someone presents with fever, cough, respiratory symptoms, fatigue, whether that's flu or COVID without getting a test. We know that children can get very, very sick from influenza. What we don't know yet is what it will be like for somebody to get infected with both flu and COVID at the same time, but I think that's very concerning. We know that both viruses are very hard on the lungs, and so the thought of someone being infected with both is very concerning. So this is the year to absolutely, it's so important to get your flu vaccine. So if you haven't yet done that, this is your reminder. And to put this in a little bit of context, last year we saw the highest hospitalization rates ever for children with influenza. There were 182 pediatric deaths in our country last year from influenza. And unlike COVID, where most of the morbidity is in children with underlying medical conditions. Of these deaths, 57% of the children had no known underlying medical condition. Also of note, 74% of the children who died and were eligible for their influenza vaccine did not receive it. So please, again, this is your reminder to go get that flu vaccine. So now I want to talk about the measures that we can take to protect ourselves and others. Hopefully you've heard a lot about these already, but we're still going to go through them. So wearing your mask, social distancing, hand hygiene, avoiding crowds, staying home when you're sick, and then being careful when you cough and sneeze. But before I do that, I thought it might be helpful to review how the virus spreads. So in general, there's 3 ways a respiratory virus can spread. One is by droplet, and this is the main way that SARS-CoV-2 spreads. So that's when we sneeze or cough, which is fairly obvious, but even when we talk, sing, breathe heavily, we expel droplets from our nose and from our mouth. And the virus can travel in those droplets, and they can travel up to about 6 feet. And what can happen is if an infected person, talks or sneezes on somebody, those droplets can then get into your nose or your mouth, and that's how you can become infected. And so since those droplets can travel about 6 feet, if you stay more than 6 feet away, you will be more protected. Another way that a virus can spread is through what's called airborne or aerosol transmission. And that's these much smaller droplets here. And these droplets can stay in the air much longer. They can travel further distance, but the virus can still travel with them. Luckily, this does not seem to be one of the main ways that SARS-CoV-2 spreads. Other viruses like measles, varicella, which causes chickenpox, spread very well this way, but SARS-CoV-2 does not. It's not to say it never is a factor, but probably in very specific circumstances, such as being in a very small, enclosed, crowded space with poor ventilation for longer periods or prolonged periods of time. That's sort of the setup where airborne transmission can play more of a role. And then the third way a virus can be spread is by contact. So if I touch something that has the virus in it, whether it's shake the hand of somebody who has virus on their hands or touch a contaminated doorknob and then touch my nose or my mouth, that's another way that the virus can spread and infect me, which is why hand hygiene is so important. So social distancing, that is standing at least 6 feet away from people who are not from your household. So remember, those droplets spread up to 6 feet. So if you're farther away than 6 feet, you will be more protected. And within a household, it's not typically recommended that you have to socially distance. There might be certain circumstances that you want to do that, and we'll touch on those later. Masks, I know we've heard a lot about masks. I cannot stress how effective they are and how important it is for all of us to be wearing our masks. If you think about those droplets, if you're covering your mouth and your nose, those droplets are less likely to travel. And if you are covering your mouth and your nose and you come in contact with one of those droplets, they're much less likely to get into your nose and your mouth and infect you. But for masks to be effective, they have to be worn properly. They have to cover your nose and your mouth. So if you're wearing your mask under your nose, which I see a lot, just think about it. Those respiratory droplets are still getting out, and you still have the potential to breathe those in through your nose. So please wear your mask over your nose and your mouth. Be careful when you remove it. Try not to touch the front of it so that in case there's any virus on the front, you don't get that on your hands. Wash your hands after you take off your mask. And if it's not a disposable mask, you should be washing it every day. Masks are very, very safe. They do not cause hypoxia. They do not cause retention of carbon dioxide. There are very few contraindications for wearing masks, one of which is under the age of 2. So children under the age of 2 should not wear a mask. Anyone who would have trouble taking it off, should they run into trouble, should not wear a mask. So individuals with certain developmental disabilities, for example, and individuals with severe underlying respiratory conditions also may not be able to tolerate a mask. These are, again, just a few examples of how not to wear your mask. I don't think I saw anyone wear it only over their nose or only on their forehead, but I've certainly seen all of the others. And then just a demonstration to be careful when you're taking it off and to wash your hands. Hand important to prevent the transmission via direct contact. Here, you can use hand sanitizer, you can use soap and water. You just need to make sure you're rubbing your hands vigorously, getting both sides in between all the fingers, and you should be doing that for at least 20 seconds. Staying home when we're sick or exposed. This I also can't stress enough, because I think we're all guilty of going to work when we have a cold, or maybe sending our kids to school when they're not quite 100%. But this is the year to not do that. I think as adults, we feel guilty if we take a day off of work. We think we're going to be giving more work to our coworkers. But in reality, if you go to work when you're sick or exposed, you're putting them at risk. I also wanted to review quarantine and isolation, because I think there's sometimes some confusion there. Quarantine is what you do when you're healthy, you feel fine, but you've been exposed to somebody who has the. Isolation is what you do when you yourself are sick or positive. So again, isolation, if you test positive or you have symptoms. This is the time where even in your own home, you'd want to try to maintain distance and have everybody wearing their masks, because if you're infected, but your spouse and your children aren't, you of course want to keep them as healthy as possible and do anything you can to prevent them from getting infected. Isolation lasts at least 10 days, because that is the duration in which you can infect somebody else when you have the virus. But in addition to waiting those 10 days, you also must be afebrile for at least 24 hours without medication, and all of your symptoms must be improving. Quarantine, again, that's when you feel fine, but you've been a direct contact of somebody who's positive for the virus. Quarantine, 14, remember, because it can take up to 4 days for that virus to show itself, and you should be monitoring yourself closely for symptoms during that time. So anybody who has symptoms of concerning for COVID, or who's been a direct contact should be tested. But it's important to remember that while you're waiting to get that test, and while you're waiting to get those test results, you need to separate yourselves from others. You shouldn't be out walking around intermixing with other people if you're potentially infected. The other thing I wanted to mention about quarantine is, even if you meet the criteria for quarantine, it lasts 14. Even if you get that test and that test is negative, it doesn't get you out of quarantine. It's good information to know, but you need to stay in quarantine for 14 days. And just the definition of a contact, that means you were within 6 feet of an infected person for a total of 15 minutes for 24 hours. And that starts from 2 days before that person's symptoms started or they had their positive test, all the way through the duration of their isolation. And those 15 minutes don't have to be all together. So if it's a few minutes here, a few minutes there, and it adds up to 15 minutes, you are considered a direct contact. Avoiding crowds and gatherings. This is really important, especially right now as we are heading into the holiday season, because we're not just talking about concerts or sporting events or big crowds like that, but even smaller family gatherings have been shown to be the source of outbreaks. So in this example here, 20 relatives got together. There was a teenager who was infected and didn't know it. And of the 14 people who were in the house together, we're not wearing masks, we're not social distancing, 11 of them were infected. 6 other family members were there, but stayed outside, distanced, and wore their masks, and none of them were infected. So I just think as we head into the holiday season, the time of year where we want to be with our family, just think about the risks for your family. I think that if we were to get together and someone were to get really sick, we would think that it wasn't worth it. But this is definitely a decision every family has to make for themselves. If your family does choose to get together, please plan ahead and think about how you can make it as safe as possible. Can you be outside? Everybody should be wearing their masks. Members of different households should stay distant from each other, good hand hygiene, and just sort of think of the ways, the measures that you can put in place to keep your family as safe as possible. I like this slide because it makes the more of these protective measures we have in place, the safer we'll be. So on the left is the COVID, on the right is the healthy person. Neither are wearing a mask, very high risk. Next one down, the healthy person has their mask on. That will protect them a little bit, but you still have all these respiratory droplets being expelled. When the person with COVID wears their mask, that's good because few of those respiratory droplets are getting out. Even better is when they both have their masks on, and then even better is when they both have their masks on and they are more than 6 feet apart. So your mask is not a substitute for social distancing. You need to wear your mask, but you also need to continue to try to maintain 6 feet away from other people. And I think this really illustrates that well, this the Swiss cheese model, so just where you have layers of protection and how each one of these layers can add more protection for yourself, because none of them are 100%. So it's only, by adding as many as you can, that's the safer you'll be. So, you have your mask on. It keeps a lot of the virus from coming through, but some still gets through. Then you add social distancing, so there's less exposure. You take care to avoid crowds and to stay outside. Add on hand washing and cleaning and disinfecting, and then this person is really quite safe. So just think of how you can add as many of these layers on to one another to keep you and yourself and your family safe as possible. A little bit about the vaccine. So we've been hearing a lot about this in the last week, and it looks promising. There are 2 trials at least already that we are learning showing very promising results with efficacy of potentially over 90%. Of course, this is preliminary. We haven't seen the final data, but definitely promising. And from what we're hearing, it's likely that there will be at least one or 2 vaccines that are ready to go to the FDA hopefully for authorization by the end of this year. These studies are looking to establish safety and efficacy. So is the vaccine safe and does it work? And like I said, so far things are looking promising. Estimates are that perhaps there will be vaccines available for the, sort of the first group of individuals to be vaccinated by the very end of this year or early next year, which is great. It's sort of the glimmer of light at the end of the tunnel, but it's important to remember that it's going to be very complicated to get millions and millions of people vaccinated in time. It's going to take several months. Some estimates that I've heard is that maybe by April-ish, sort of the general population will have vaccine available. That's yet to be seen, but it's important to remember that it's going to be several months. So while that's promising, several months is a long time, especially in the middle of a pandemic. So it's really important to just stick to all these protective measures that we've been talking about. All right, so now let's switch gears a little bit and talk about how do we live in this time? How do we send our kids to school, play sports, work in the middle of everything that's going on? And I think everybody on this call understands how important it is for our children to be at school. In-person learning is so important and virtual learning is so challenging, whether it's a child that doesn't have a computer or a reliable iPad or reliable internet access, or a child who has learning differences that makes it difficult to learn virtually, or just a child who can't sit in front of a computer all day long. There's so many things that make that difficult. But there's other things at school that for why it's important to be in school as well. For example, the socialization that occurs, whether it's the little ones who are learning those socialization skills or our adolescents, where their social life is such a very important part of their existence. And then all the services that our children get at school, whether there's therapies like speech and OT, PT, whether it's nutritious meals or even access to healthcare. There's so much that happens in that school building and don't have access to when they're not there. And I think our schools have done an amazing job over the summer, working to get the schools ready and then continuing to adapt to make them as safe as possible. It really has worked out fairly well. We have not seen a lot of cases where being in the school itself is where outbreaks are starting. But it's really difficult. All these measures that we talked about, the mask, the distancing, the hand hygiene, all needs to be put in place. And not every school has the resources they need to be able to do it to the extent that they would like or would want to do. And then when you think about just all the different ages that we're talking about, that adds another challenge. So what works for one age group or one grade is not what's going to work for high schoolers. And even that, when you think about kids, I think sometimes we don't give kids enough credit. I think they can do a lot of what we ask them. I personally was never too worried about our children wearing our masks. I think once we teach them and show them, they can do a lot. But they're social beings. So being socially distant is not in their nature. And that in and of itself adds more challenges to this. I think schools are taking different approaches. What works for one school is not going to work for another school. So I'm just going to go through some general measures that schools are taking. And I think focusing on areas where social distancing is difficult can be really helpful. So examples of lockers, kids really congregate around their lockers. Some schools are choosing for children not to use their lockers. Other schools are choosing to send kids to their lockers in cohorts so they can stay more distant. Pick up and drop off is another issue. Lots of congregation occurs there. Some schools are staggering times, which can be helpful, although I don't think all parents have that flexibility in their schedule. Hallways is another one. That's what I see a lot at my son's school. How do you keep kids from just being on top of each other in hallways? And some schools have the traffic going one way, which can be helpful. Other schools allow different paths, so maybe the kids can go outdoors to get from one part of the building to another. School buses, if you think about it, are small enclosed spaces where people are really on top of each other for periods of time. So not good in a pandemic. Keeping the kids as distant as possible, wearing their masks, good hand hygiene, keeping the windows open, those are all things that can be helpful. The cafeteria, another place where kids like to congregate. And not only that, that's their social time, right? So they're letting their guard down a little bit. They want to be social. So some kids are eating in their classroom, sometimes outside, which is great. And again, some schools are using cohorts where children go to the cafeterias in smaller groups and can spread out. Again, other measures that are important, the cleaning, disinfecting supplies, and then having a plan for children who are sick. So I think our school nurses have done a really great job at this, learning the symptoms of COVID, identifying children who are not doing so well, and then having an isolation plan where they can have the child spend time, monitor the child is safe, but they're not potentially exposing other children. I've mentioned cohorting, so I just wanted to go into that in a little bit more detail because I think it can be helpful outside the school setting as well. So cohorting is when you have groups of children, and within each group the children can interact with the other children, but not across groups. These kids can interact with each other. These kids can interact with each other, but not across the group. So if, for example, this child here was infected with COVID, this is the number of children who would need to quarantine and who are at risk for infection. But none of these other kids would be. As opposed to if there was no cohorting and were intermixing, if one child was infected, then potentially all of these other children would need to be quarantined and would be at risk for infection. And some schools have been able to implement this. I think it's potentially easier in the younger grades where the kids are in one classroom all day and not every child has a different schedule and they're not going to different classrooms. But it can be really helpful. And I think it's also just something to keep in mind because you might be able to apply it as well for your child's social activities. So I just wanted to mention that. As far as symptom screening, a lot of schools, a lot of businesses, a lot of workplaces employ this. It can be helpful, but it's important to realize that symptom screening is not going to catch everyone. If you think about how many individuals have the infection and are asymptomatic, they're going to pass a symptom screen. And not only that, COVID symptoms overlap with a lot of other illnesses. So you might screen positive, not from COVID, and maybe not even from an infectious illness. This also takes a lot of resources, which some schools may not have available. Some schools are electing to have kids screen at home and fill out a form or do it electronically. But I think the bottom line is if we all do our due diligence and don't go to work when we're sick, don't send our kids to school when we're sick, really there should be very few people who are failing a symptom screen. Sure, you might have occasional instance where you feel fine and you have a fever or don't know it. But other than that, really, ideally, we would be catching this at home. All right, let's talk about sports. Sports are so important it's the main source of exercise for many children, main source of socialization for many children. Some children are competitive and thinking about scholarships. So can it be done safely? And there's definitely risks, but there's risks with everything we do right now, whether it's playing sports, going to school, or going to the grocery store. The risk is going to depend on several factors when it comes to sports, the type of sport. So wrestling, of course, is going to be very different compared to something like tennis or golf. How much the equipment is shared, whether or not the sport is played indoors versus outdoors. Outdoors, of course, being safer. How much the teams interact with each other and travel, that will just increase your exposures, which will increase your risk. And then how much all of the other measures we've already talked about are being enforced will influence the risk. So some general recommendations: maintain social distancing for athletes, staff, and spectators on the field, but not just on the field. It's not just the field of play. It's when the kids are coming and going, what's going on in the dugout, on the sidelines, and in the bleachers. And what seems to be the case is it's not actually the playing of the sport itself, but it's all these other activities around it that seem to be more of a problem. Masks should be worn by athletes, coaches, spectators. Equipment should not be shared if at all possible. And then, of course, the hygiene measures. Arkansas has some guidelines. I just kind of picked a summary highlight slide here, but social distancing of 6 feet for everybody except for athletes when they're actively playing, and that includes spectators. They do screenings for athletes and coaches and staff before activities. Face covers are required for athletes except for when it's inhibitory to the activity. So certain sports, you definitely can't wear masks, like gymnastics or chair, water sports, of course. And then just depending on how vigorous the activity is, a mask may not be tolerated. The way it's worded, coaches, staff, spectators over the age of 10 must wear masks, and then it's strongly encouraged for the younger spectators to wear them. Locker rooms definitely need to maintain social distance. I just wanted to mention a little bit about returning to sports after those of you who have child athletes. So we know that COVID-19 can affect and so the AAP and other organizations have put together some guidelines, which, we're still learning about this. These may be revised, but as of now, it's recommended that any athlete who's exposed to the virus have a 14-day rest period. But if you think about it, that would pretty much cover our quarantine. The AAP recommends all athletes with COVID, regardless of symptoms or no symptoms, be cleared by their physician before they return to play, and that return to play be gradual. And then anyone who's had really anything more than just some mild symptoms may require a more thorough evaluation, including an EKG and probably an evaluation by a cardiologist. So I just wanted to make sure you were aware of that in case you have athletes in your family. And then finally, let's turn a little bit and talk about stress and coping. So these last several months have been very difficult for all of us. We've had many losses, many stressors, both kids and parents alike, whether that's illness related, if someone in your family has become ill, job related, if someone in your family has lost their job, or even just adjusting to working from home, all the stressors related to school that we discussed. There's probably none of us who either ourselves or our children haven't missed an important milestone or not been able to participate in important activities. And all of this, it's a lot. It leads to stress, anxiety, depression, and in our children, behavior problems as well. So I just wanted to go over some of the signs that children show when they're struggling and that you could look for in your children. Some children are overly clingy or have difficulty separating, especially the younger ones, or may show a regression of skills. So for example, a toddler who was toilet trained who now starts to have accidents. Some children simply just aren't interested in doing the things that they used to like to do. Some have a hard time paying attention or concentrating, whether that's schoolwork or other activities. Some children will appear frustrated and angry. Any change in sleeping patterns or appetite and eating patterns could be a sign that your child is struggling. And then some children just show different behaviors, maybe some attention-seeking behaviors where they're doing something that they know will get them in trouble, but they're just craving that attention, or perhaps acting more defiant than what is typical for them. And then some children can actually show physical symptoms when they're struggling emotionally. Headache and abdominal pain are quite common. So how can we help our children cope? It's really important to talk to them about COVID directly and ask them what's worrying them. We know that they're hearing about it, whether it be, from their friends, learning about it at school, social media, or wherever. We know that they're hearing about it. And so talking to them about it, finding out what they know is really important, because if they have some misinformation or misunderstand something, you could correct that. It's important to validate their emotions and let them know whatever it is they're feeling right now is absolutely fine. They have a right to feel whatever way they feel. But it's also important to help them find ways to occupy their minds and maybe help reframe their negative thoughts. So it's understandably so easy to focus on the negative right now. So if you can help your child just look at things a little differently, maybe find something positive out of all of this, that can be really helpful. So for example, maybe there was something they missed out on over the summer. They couldn't take a trip that had been planned or go to a summer camp. but maybe at the same time they were home and you were able to do things together that you wouldn't otherwise have been able to do. That's something that you can help point out to them and help them look at things a little bit differently. Routines are so important for our children. Right now, that's a challenge. Our routines could be changing week to week, but if you can help your child create a routine so that they know what to expect in their day and what's coming in their day, that can help alleviate a lot of anxiety. Try to be as reassuring as you can, but be honest and be available and be calm, which is a lot easier said than done. By be available, I mean just when your kids want to talk, talk. I have teenage boys. They almost never want to talk. So when they do, I feel like that's when I drop whatever I'm doing and take advantage of that time. And then as far as being calm, our children, they read us very well. When we're worried, when we're stressed, they sense that, they see that, and sometimes they feed off of that. So just trying to be as calm as you can be helpful. Some other concrete measures, helping them regulate their emotions, teaching them relaxation techniques, breathing, exercises, yoga, or any form of exercise can be a great stress reliever. So encouraging your kids to be active is important. Limiting media exposure, here I mean specifically related to the pandemic. I think even when it's reliable information, good news, and it can be really stressful and anxiety provoking. So just keep an eye on that. Help them stay connected with others and find ways to honor their missed milestones. You know, feel like parents right now, we have to be as creative as we possibly can be. Not easy for many of us, but even doing little things to just let your child know that they're special, that can be really helpful. Be a positive role model. So all of these things that we're asking our children to do, we need to be modeling for them. So wearing our masks, social distancing, hygiene, showing them how to do all the things we're asking of them. And then don't forget to take care of yourself, because we all know that it's hard to be a good parent when we ourselves are struggling. So be kind to yourself. It's okay to lower that parenting bar right now. We're in the middle of a pandemic. But it's important to set goals for yourself, because it seems like we've been in this forever. And although we can see the light at the end of that tunnel, it's still a little ways away. So setting some goals for yourself that you can achieve can be really helpful. It's important to take care of yourself and stay connected to your own support system, whether that is Zooming with your friends, talking on the phone, or even getting professional help if you need it. And then just to mention, we've been talking about emotional health. Don't forget our physical health. Pediatricians, we saw a huge drop off in well child exams and vaccinations early in the pandemic. And even though that's getting better, it's not where it should be. And I personally worry about the things that we're missing, whether it's a child who's not growing properly or not developing properly, not speaking properly. So don't skip your visits with your physician, and eat for yourself as well. If you're due for a mammogram or a colonoscopy or a lipid panel, don't put it off. I think we are going to see a lot of negative health effects from this pandemic unrelated to actually being infected with the virus. And I think delays in our own health care are one of them. So just again, skip and don't delay. All right, so that is everything I have. I am going to stop sharing my screen, I think, if I can figure out how to do that. Where did it go? And then we'll hit some questions. So Dr. Only, have you found any questions that you think we should take a stab at?
Yes, that was an excellent presentation. It was very thorough. And I think we've answered a lot of people's questions, because we only have one in the bin so far.
Oh, so please type some questions if you thought of any.
Hi, this is Dr. Abraham. I think this question is related to rotavirus.
Oh.
And yes, there are still cases of rotavirus, although it's a lot less since the vaccine came out in 2006. Most of the kids who get rotavirus these days are unvaccinated.
Very good. Other questions do you have? Dr. Abraham, is there anything you want to add from an infectious disease standpoint?
Yeah, great. You know, it was a very complete presentation. I was really interested in some of the responses that you all gave to the webinar survey. certainly understandable how difficult this time is for everybody. You know, we're all pretty busy, but if you were at a stay-at-home parent, or if you didn't have the kind of structure that people do when they have to work 9 to 5, how do you make that structure for your family when you didn't have that in the first place, to make sure that your kids are getting schooled and that their time is being taken up, and everyone's just not watching TV all day, and the kids don't think that this is a permanent vacation. So really, for those of you who have been able to do it, that's really amazing. I was also really interested in the response to where we're getting our information. And I don't know how you all feel, Dr. Hartford and Dr. Olney also. I'm certainly increasingly suspicious of social media. I'm very concerned that through no ill will, but the ways that the programs, the computer programs, dish out advertising influences what type of information you get. And just like sensationalized headlines used to sell newspapers, it seems as though misinformation sells advertising. So I would be very careful about getting information from social media. It works about the same way as the little boy on the side of the street selling newspapers by yelling some sort of sensational headline. The other thing that tends to happen in social media is, and this is also because of the advertising algorithms, they want you to stick to whatever site they're selling ads from. So say it's Facebook. Well, Facebook will get you to stay on Facebook by connecting you with people who Facebook thinks your opinions are the same. So you end up not really learning anything, but sometimes get pigeonholed into sort of these misinformation groups. So, you know, TV news is pretty good. I tend now to watch lots and lots of different TV news rather than sticking with just one. But certainly my absolute favorite place for COVID information is the CDC. And I was really glad to see that a lot of you agreed.
We have another question. Someone is asking, where can they get the coronavirus? Anyone can answer.
The virus.
Yes.
I would say anywhere. Absolutely anywhere. Is that what you mean? Was it the virus?
Yeah, that's what they're asking.
Okay.
Yeah, and I agree with you. You can get it anywhere. You can get it at home if someone at home has been exposed to someone else. You can get it in any crowded space. Yes, I agree.
Yeah.
And the risk of getting it somewhere is different for different places, and depending on how many people are in those places. The risk of getting it at a 25-person Thanksgiving reunion is a lot more than 5 people walking outside in the park. But it's not zero when you're walking outside with 5 people. It's only 0 when you're walking outside by yourself. So it's graded risk. There are things that are low risk, and there are things that are very high risk. There's also activities that have been identified by studies that don't give us a real sense of what the risk is, but we just know the risk is higher. We know that people who go to supermarkets, the risk is higher. We know that people who go to restaurants, the risk is higher for those people to get COVID. Whether or not we should be going to restaurants and whether or not we can or should be going to supermarkets, that's a really big question. I do think it's really important for everybody to know what the reality is so that everyone can make their own personal decision.
Someone has cleared up the last question. They stated that they're probably asking if they can catch it in places like church.
Oh, absolutely.
Mm-hmm.
I think there have been good examples of outbreaks starting from church services. If you think about it, you're close, you're singing, tends to be a lot of people crowded together.
Mm-hmm.
Yeah, there have been many reported cases of COVID-19 transmission in churches, including a nationwide reported outbreak from one in March here in Arkansas that resulted in several deaths. There was also a very interesting outbreak very early in the epidemic on the West Coast. It was about 80 people who were practicing for chorus, and none of them had symptoms. COVID-19 was, I don't even think it was called COVID-19 yet, but the outbreak was just sort of starting on the West Coast. They had their normal 2-hour practice. 80% of them became infected.
Wow.
So my take on this virus is if it's going to take advantage of us, it's going to take advantage of us. And it has at every decision we've made when we've made the decision not to be careful.
Mm-hmm.
When the virus was first being described, it was only droplet precautions, and then it was droplet precautions and surface. And then it was droplet precautions and not so much surface, but now also aerosolized. And Dr. Hartford had a screen on that which showed the importance of the difference between droplet and aerosol transmission. One of the ways to think about that is droplets are heavy enough for gravity to bring them to the ground. So that's why they fall to the ground in 3 to 6 feet. Aerosolized particles aren't affected by gravity. They're affected by wind currents. So they can stay in the air for hours. And the classic is the aerosolized particles of measles. Somebody can have measles in a room. That person can leave the room, and 8 hours later, somebody else can come in the room and get measles. And measles is probably about the most infectious, or one of the most infectious pathogens there is. Certainly, a bunch of people singing in a room together who will most get sick suggests aerosolized spread. And the other thing to remember about aerosols is that they can be spread through the air conditioning system in a building. So every time we've sort of underestimated the virus. Another thing that's going on right now is, very early on, I think there was a report of a dog that might have had it. Now they're finding all sorts of animals that can be infected. In Holland, they had to kill millions of mink because the mink were all getting infected, and the mink were infecting humans. And there's a certain type of fox in I think Siberia, which also gets infected and also infects humans. Every time we try and second guess this virus, we're out of luck. So there are so many things that this virus can do that it's very, very difficult to predict how to be safe. Wear your mask, wash your hands, cough etiquette, social distance. Without a doubt, those things have been proven to decrease the amount of people who get the virus, decrease the amount of people who get sick from it, and decrease the amount of people who die from it.
Okay.
Thank you.
Next question is, where can I get the vaccine?
I don't think we know the answer to that yet, do we?
There are 2 trials in Memphis.
Oh, good. Oh, you mean if they wanted to enroll right now?
That's the only place you're going to get the vaccine right now. Yeah.
Okay. Next question. She wants to know, what have we heard about flying? What do we know about flying? She says she researched the airlines and she knows that they're doing all sorts of things to protect us from fresh air in planes, and she's now to wetting air and cleaning between flights. I probably read that wrong, but you get my drift.
Hmm. I'd be glad to talk about that too.
Yeah, you can take that one.
Yeah, that's another one that that just sort of is a bouncing ball that you get, or it's like herding kittens. The great thing about airplanes is that they have a very efficient HEPA filter system that circulates air in the airplane several times an hour, which is what you need to take the coronavirus out of the air. They've also shown that if everyone wears a mask on a flight, it definitely decreases the number of people who might become ill if somebody on the flight has COVID-19. However, only a couple of people need to take their mask off for that effect to completely go away. So if somebody has COVID-19 on an airplane, it is very likely that if that person doesn't wear their mask, that multiple people will become ill on that flight.
Yes, I also think, you have to take in consideration, you can't keep 6 feet separation on an airplane. And in order to get on an airplane, you have to go to an airport.
Mm-hmm.
And you have to stand in line in the airport. And it can get very crowded. So these are things that I think you should take in consideration before flying.
Certainly, if you're immune suppressed, or if you care for people or have household members who are immune suppressed or at very high risk of getting disease, elderly, diabetics, people with lung disease, cancer, organ transplants, things like that, you yourself don't want to be taking those type of chances.
Okay. Next question is, shouldn't there be a mask mandate since studies have shown that wearing a mask is not harmful?
I think we have a mask mandate, don't we?
Yes.
But how you enforce everyone to adhere to it, I think, is the question. Maybe you mean nationally, and again, that would be nice, but I don't know what we do about people who still don't adhere to the mandate. They've been shown to make a difference. When you look at certain studies who've been published, they absolutely make a difference, but I don't know how we get individuals who are resistant to wearing their masks to wear their masks.
Yeah, states that had mask mandates decreased the transmission of the virus substantially compared to states that didn't. And even in, I think it was Kansas, when they looked at individual counties, the same was true. So mask mandates work. Not everyone wears the mask, but I think it has a sort of we're all in this together effect.
Someone is asking, when are they doing vaccines in Arkansas?
I don't know if we have an exact answer to that. Do you know, Dr. Abraham?
No, I don't know if what either you've heard. Right now, Pfizer is putting in place the infrastructure to deliver vaccines in 4 states. Tennessee is one of them, to try and work out all of the bugs. Their vaccine needs to be transported at -94 degrees and needs to be stored at -72. And there's a lot of things that they need to work out in order to make sure that their vaccine arrives to all of the sites in so that it's still effective. Because if it's out of that temperature for any period of time, the vaccine is inactivated. They're doing that now. I do think Dr. Hartford mentioned that we will probably have FDA approval of the vaccines either in late December or early January. And then there are panels right now that are trying to figure out who should get the very first batches of the vaccine. Should first responders, police, fire departments, emergency medical technicians, people who are very at risk of being exposed, and at the same time, if they become ill, will completely lose the police department, fire department, and emergency medical technicians. That would be disastrous. So a lot of people are talking about those people getting sort of the first round. And as more and more vaccine is available, nursing home patients would be a logical next group of people, and the people who care for them. And people with disabilities or immune deficiencies, people who are most at risk. So it'll probably be these stages of rollout throughout the country.
Okay. The next question is, if you travel out of state, do you have to quarantine for 14 days, even though you don't have the virus?
I don't actually know for Arkansas what.
You don't, but if you're coming from Arkansas, it depends on what state you're going to.
Mm-hmm.
There are several states that will make you quarantine for 2 weeks if you come from Arkansas, because although we have a low population, the number of people who are infected in Arkansas per population is extremely high.
Mm-hmm. I think that's another thing that keeps changing too. Different states keep adding restrictions from other states, just depending on what we're seeing with the numbers of cases.
Well, there's another question. Can this presentation be sent in email to others? And someone would like to send it to their coworkers.
I think this is going to be put up on our YouTube channel, and probably we'll have something on our Facebook page about that. So keep an eye out.
And this looks like the last question.
Okay.
My mom traveled to Florida and she's coming back on Thursday. Does she have to quarantine for 14 days?
I'm sorry, I don't know the answer to that for Arkansas.
Only if she's been exposed to somebody, and since she's coming from Florida, that's pretty possible.
Yes.
I know that what I did with my daughter coming home from college is we quarantined her. Well, you don't have to quarantine, but I mean, we quarantined her for 2 days, and then we had her tested. Walgreens is giving tests, and there's also Our Care is giving tests. There's several places around town where you can get testing. And so she didn't quarantine for 14 days. I think it wound up being about 5 because it took about 3 days for her to get the results back. So that's one way around the whole quarantine situation for a healthy person.
Well, Dr. Olin, did she have a known exposure?
I'm sorry? No, she didn't have an
No.
exposure either.
So she didn't have an exposure, so she didn't really need to be quarantined. I think you were just being safe. It's pretty important to clarify that if you are in quarantine, is you've had an exposure and the Department of Health has given you a call and said, hey, you need to be in quarantine. You can't actually test out of that. And that's because the level of virus sort of is different on different days after you've been infected. And it can actually take about 14 days before the virus even starts to show up. So that's why you can't test out of quarantine.
Thank you for clarifying that. All right, so is that the last question? It's a little bit after 7. All right, well, thank you all for attending this webinar. I hope you found it helpful. And I do think we'll be posting it, so just keep an eye out on our Facebook page. And thank you for attending.
Thank you. Be safe.
Dr. Abraham and Dr. Only, thank you for attending as well.
Oh, sure.
We're all in this together.
Yep.
All right, take care, everybody.
Bye-bye.